Wow, it was so good to have a tea break. That feels me so comfortable that, yes, it reminds us that food is so important for all of us. Yes or no? Yes or no, we are for the debate. Thank you very much. Okay, and I'm pleased and that diet is important for all of us. And few sayings come to my mind. You are what you eat. Let food be thy medicine. The Hippocrates, the father of medicine, says that, and a great philosopher. And we've been hearing so much from the morning. An apple a day keeps a doctor away. But who eats an apple these days? That's what I am saying. Why are the slides open? So here we are. It is generous that the doctors decided, the ladies first, and I'm here over here to talk about diet versus surgery and what's the best path. A little background. As I was saying, many years before, I was here for a surgical gastric bypass conference, for a roundtable conference meeting, where I was among the surgeons. And today I'm very happy because I'm coming back again here in this place, talking about diet versus surgery. Thanks to the experience, thanks to my mentors who have given me a lot of experience in this area. So this is my premises where I've been there for last 8-10 years, the Apollo Hospitals, Navi Mumbai, and that small little green zone is the OPD block what we have, but we control on all the foods because it's the food which is the requirement. Patients are happy to walk in, not sure whether they are happy to walk out. I think this site is very, very happy. Does it bring happiness or sadness? I need a response, please. Anyone? Are you all happy? Can you associate? Can we associate? Nobody eats jalebis? Yes or no? No? Fine. Okay. So basically this person comes to hospital and then he walks out and then he finds in the regular Tela wala this, he's going back and eating his favorite food. But he doesn't eat one, he eats more than what is required. So whose help he needs? Wife, finance, or who else? So my point of discussion is that we are going to navigate the weight loss journey as between surgery or diet. What are the benefits, risk of weight loss surgery, and many modalities what we use for weight loss. It's not only the battle between diet and surgery, because nobody will step into any clinic and say, yes, I want to get operated. Nobody gains weight overnight. It is metabolic, it is physiological, it is psychological, there are eating disorders, problems are many, and the support systems are also many. What I am going to talk is about A, B, C, D, E, F approach. Okay, so we can remember how a clinical dietitians would be working. Types of, I'm not going to give any remedy how diet is going to help, because somebody did mention that Google helps, but we know that doesn't help. And if I start talking about diet, my 20 minutes will go in that there are so many different types of diet. So yes, there is a complex situation in that, but we will make the things complex into simple. That's our profession. And what are the clinical evidence? Because finally research is what we use as guidelines. So this gentleman needs everybody's help. He walks to physician because his lab reports are not okay. So he said, okay, I need to control my sugars, but he also has a fatty liver. Then he's so fed up. Then he said, yes, I need to go to a surgeon. But I've already visited the dietitian. And the surgeon says, yes, still you have to visit a dietitian. Wow, so diet is important. That's what I want to say. Clinical psychologist. Half the time, the nutrition becomes the clinical psychologist. We are talking to their family. We are explaining the food. खाते मुंह से है लेकिन सोचते हैं दिमाग से है अभी बोलते हैं खाना है लेकिन बाद में बोलते हैं नहीं खाना है so there is always a juggle. So being a clinical psychologist to our patients is very important. So it's a multidisciplinary team, but yes, in the all aspects, it is this gentleman who's eating, and this gentleman needs to be told that he should not be eating, or there should be a portion control. I am sure everybody will agree to this point. So it's a doctor or a physician or a surgeon, and on the side, there's a dietitian who gives ample of food choices. What do you want to eat? Monday is this day. No, now is the Muharram, now is Navratri. We want to fast. Then comes the phenomenon of intermittent fasting. Wow. So options are many is what we want to say, but discipline is required. So actually, it's a complex decision, and it's not easy. It can be easy if we make rules like our signal rules, and that is what we try to do. We do green, orange, and red. So when we do green, orange, and red, you know what is go-go food. Yes, orange, jalebi, orange, yes. Come khao, taste karke khao. And red means strictly no. There could be times when you would be strictly no when there are certain challenging comorbidities which could be life-threatening. And such challenging comorbidities do happen after surgery. Patients who undergo gastric bypass, they are being told, eat your food slowly and put bit by bit. So what will they do? Their brain is asking to chew popcorn because whole life they have gone munching. They'll hold the popcorn in the mouth, go on sucking. So we know all the secrets what our patients try to do because they come and tell us. I did not know I was going to be the first one, but yes, I thought I will quote that yes, there will be in detailing about what the weight loss surgery helps. It does help you in the rapid weight loss, 10% or more, and the graph goes. So people are happy. They cut down about 30 kgs in next 3 months or what the figures go like. Metabolic improvement, great. That is what one wants. HbA1c under control, dyslipidemia, reversing of diabetes, fatty liver. But how long? It's the mindset and it's your diet which is going to help you out. So please remember this point. Whether a surgery, whether any kind of non-invasive treatment you take, still diet is going to be part of his life. Long-term success is a question mark because we really don't know whether it works, not works. It may work with some people, it may not work with some people. And there are hormonal changes, which could be like female populations, generally PCOS, want to conceive. And we have seen a success story, I will not deny to the fact. That success story did help her to lose weight, but again, there is a rebound. So here, again, a diet has a major role to help you out. Surgery is giving you benefit, but what's the likely risk? Risk is for everything. Even if you are following the signal, there is a risk. So there is a risk of surgical complications. We did understand that, yes, in the previous talks also, surgery will have cause of post-surgical infection during the surgery, complication, anesthesia. Maybe it's rare, but there is a small percentage because that's why you all sign the consent. But perhaps we don't sign a consent if you are doing a weight loss. People want to gorge food, and after surgery, there is a big time loss because there is a disconnect with food. So they feel psychologically deprived of not getting food. And nutritional deficiencies, if many of you all did not know, after a bypass or a sleeve, you have to take micronutrient supplementation for your lifelong, or else you correct your diet in such a way that you need to take care of your fluids, hydration, the proteins for your muscle mass. You have to have exercise, and then all your immune nutrients which are going to take care of your life, you need to take it. Let's talk about diet prior to surgery. Calorie restrictions. People walk into cabin, I want to lose weight. But okay, there are surgeons, not our surgeons, because they told me they don't do that. So there are surgeons who just decide to operate, but they do not educate that there is a calorie restriction. You have to be on clear liquids prior to surgery, post-surgery. There will be a focus on proteins because your stomach is going to become like an eggshell, or it will become like a thin sleeve. So these are the important predominant factors of nutrition and diet we have to cater to. So diet does play a role for weight loss in all phases of your life. Post-surgery, he was already on a 15-day pre-surgery diet. Post-surgery, generally there is a rule of 2. Maybe most of you all know, 0 to 2 days, NPO out to 2 days of clear liquids, 2 days to 2 weeks of full liquids with emphasis on high protein and high fluid, must. Then 2 weeks to 2 months, which is a long period, which is on a puree diet, soft diet, and lot of varieties start taking. And then they come on a soft diet, which is a small plate. I just given an interview yesterday, what is the benefit of eating from a small plate? So it's a lot of mindfulness plays. But yes, nutrition comes with a platter. You cannot compromise on any nutrient. If we start counting, 100 will be also a lesser number to count our nutrition. So to educate our patients who have undergone bariatric surgery or planned for surgery, I think we have to take them through all phases of diet. whether the diet will work in which of your BMI, or if you've undergone a surgery, and post-surgery long term, whether the first thing, मैं समोसा खा सकता हूँ क्या? मैं कितना खाऊँ? कितने बार हफ्ते में खाऊँ? So all their questions are diet centric. So that time, for some time, they forget medicines, they forget surgeons, it's the food. So food and mood goes hand in hand. Proteins, we have to educate what proteins are a priority. Of course, exercise is also a priority. Supplements is important, and mindful eating. What you eat, when you eat, why you eat, how much you eat, all matters. While you're eating, you should focus just on eating. Chew your food like we tell kids, eat, count 32 times. So similarly, you do not swallow. That's why in bariatric patients also we give them advice, never suck with a straw, have sips slowly. Don't inhale air. Chewing the food is the first thing which will give a satiety to our brain and a hormonal signal. What the diet works on? Prevention, treatment, and maintenance. Your medicine box is in the house. Use your food in a limited portion control. And that's why some patients have got results on intermittent fasting and insulin resistance to beat up, because diet does work. In COVID times we saw, in surgical times we saw, and in pre-op, you do need some importance, because any surgery, any procedure will be always backed with a micronutrient boost. Maybe it's coming through an IV, or whether it is coming through a supplement or an oral drink, which could be a protein and calorie enriched. So we will take this approach, diet approach or surgery approach. Actually, it's both together. Who wants to take a lead? That will vary. There are guidelines and considerations, and if you look at, I think I will leave it to the doctors to talk about that at what BMI would you take surgery as an option. But the problem, what I would like to highlight is the center. That center should have been orange. I could not get a proper orange font in my, while I was doing my slide work, is most of us are in the overweight range. And we are prone for obesity, or we have a fat composition which is on the higher side. And if we don't tackle that, we are getting into a overweight or obesity grade 1, 2, 3. Yes, there would be an option of surgery, but that's later. You will earn money first and then think about saving it. So it is like that. You take care of your diet today and tomorrow, and later on you are relaxed, whatever it is. Psychology is going to play. Behavioral changes all the time. Food is in your mind. And as a clinical dietitian, we tell patients, but when we can't do it, we do their assessment through the psychologist. So it's not only a battle of dietitian and a surgeon, but a clinical psychologist. Because you know, our energy should be reserved and given it to the specialist. They do a lot of assessment, cognitive assessment and other assessments. And because there is lot of body imaging issues, शादी है, वजन कम करना है, husband को मैं पसंद नहीं आती, yes, so we have to understand and hear to our patients. But the whole thing is, this leads to emotional eating, under eating. Anorexia and bulimia are two different sides what we have to manage. So psychology does affect your gut hormone, it does affect your brain hormone, the leptin and the ghrelin and so on. So food should be used like a balance scale in a portion control. Collaborating with the experts is the best thing what I would kind of put up. So you have the medical professionals, you have a dietitian, you have the mental experts who are going to help with it. Cost, diet cost is limited. Surgical cost is definitely multiple times higher. I already talked about this. ABCD is very self-explanatory. When we plan diets, we look from the anthropometrics, biochemical lab test, which could be like 10 to 20. Clinical signs and symptoms, dietary history, which takes a lot of time. A lot of time is gone with taking diet, but it is giving you results on slowly and steadily wins the race that time. So this is what we do. I did say that I'm not going to talk about diet types. You will have to consult us separately to take that. But we do have success stories if you just put on the image and you get. But I thought I'll just put some paper research and just talk about the latest research, that optimal diet strategy for weight loss and weight maintenance. There is a definitely optimal dietary approach for safe, effective and sustainable weight loss in overweight and obese patients, adults. So no shortcut and fast results. What you lose can come back Diet approach is most important. Gradual improvement is going to help. Surgery may give you rapid improvements, but the surgeon can tell you better, and monitor with us. Get fat to fit, find your right path, and it's not a shortcut diet, it's a long-term lifestyle change. Thank you very much.